Good evening. Welcome to the Multi-Ministerial Task Force Press Conference. On our panel today, we have Minister Gan Kim Yong, Minister Lawrence Wong, and Director for Medical Services, Professor Kenneth Mark. May I now invite Minister to begin with a few words? Minister, please.
Thank you. Thanks for coming to this press conference. Overall, the number of new COVID-19 cases in the community has remained at about one per day on average in the past week. But we continue to keep a very close eye on the number of unlinked cases in the community. This totaled 7 cases in the past 14 days. That is fewer than one per day. Most of these cases were identified through rostered routine testing, or what we call RRT, of workers from the construction, marine, and the process sector. Most of these workers also tested serology positive, which indicates past infections. The number of imported cases averaged about 6 in the past week. They had all been placed on stay-home notice or isolated upon arrival in Singapore, so the risk of transmission from this group to the community is very low. We test them before the end of their SHN, and this is how we picked up the number of imported cases, including asymptomatic cases. Our daily number of COVID-19 cases has dropped significantly over the past week as dormitory clearance was completed. We still have about 14,000 migrant workers who are now under quarantine and who will be tested before they complete their quarantine. But as workers return to work and workplace interactions increase, we expect to see fresh cases from those residing in the dormitories. To detect cases early and ring-fence them quickly, we are testing them regularly through the RRT, which will allow us to pick up asymptomatic cases too. I would also like to advise everyone, including Singaporeans, to seek medical attention early if you are unwell, even if your symptoms are mild. This way, we will help to detect the cases early and allow us to ring-fence the infection. Even as our community numbers remain stable, it is crucial that we continue to be vigilant and adhere to the safe distancing and safe management measures. This is the key to preventing a second wave of infections. It has been almost 7 months since we had our first case in Singapore. I understand many Singaporeans are feeling the fatigue from safe distancing measures. But I believe most Singaporeans understand the need for these measures and are doing their best to comply with these rules. The Multi-Ministry Task Force will continue to carefully resume economic and social activities while putting in place measures where necessary. I want to caution that this gradual resumption does not signal that things can go back to pre-COVID-19 days. Where we need to, we will continue to tighten requirements when we find persistent non-adherence to these measures. Lucky Plaza and Peninsula Plaza, for instance, attract large crowds and long queues to enter on weekends. To better manage the crowds and ensure the safe distancing can be observed, from 29th August, these 2 malls will implement odd and even date entry restrictions on weekends. This means that those whose NRIC or FIN numbers end in even digits can only visit the 2 malls on even days on weekends, while those numbers who end in odd digits can only visit these malls on odd dates for weekends. We did something similar for our more popular markets recently, so it is a system that we are familiar with. The Multi-Ministry Task Force will continue to monitor the situation closely, and other premises that face similar crowd management issues may also be required to adopt this entry restriction if necessary. These measures illustrate the approach we have adopted, which is to regularly calibrate our measures to balance the risk of transmission and facilitating a new COVID normal situation. Where we need to, we will put in additional measures to enhance compliance and close gaps. Similarly, we may adjust existing measures as the situation evolves. But I have to emphasize once again that ultimately, everyone has to do our part to stay vigilant and not let up on the discipline we have developed over these few months. This way, we can keep our case numbers down and keep our families, our friends, and fellow Singaporeans safe. Thank you. I'll now invite my DMS, Professor Kenneth Mark, to give a quick update on today's situation.
Thank you very much, Minister. As of the 21st of August, 12 noon, the Ministry of Health has preliminarily confirmed an additional 117 cases of COVID-19 infection in Singapore. Based on our investigation so far, there are 6 cases in the community, of whom 3 are either Singapore citizens or permanent residents, and 3 are work pass holders. In addition, there are 13 imported cases, all of whom had been placed on a stay-home notice and were tested before completing their stay-home notice and were picked up then to have COVID-19 infection. We're still working through the rest of the details of the cases, and this will be released through our usual MOH press release that will come out later tonight. Thank you.
Good evening. The COVID situation around the world is very fluid and it is changing very quickly. So we are updating our border control measures based on our latest assessment. We know that some places have been able to control the infection effectively and the risk of importation is low. Our assessment is that there is no need for a stay-home notice requirement for travelers from these low-risk places, and a COVID-19 test will be sufficient. So we will start cautiously and lift the travel restriction for visitors from 2 countries, namely Brunei and New Zealand. In other words, for travelers who have been in Brunei and New Zealand in the last 14 days prior to entry, when they arrive in Singapore, they will undergo a test at the airport, and there is no need to serve a stay-home notice. There are other low-risk places where the stay-home notice may not be required, but out of an abundance of caution, we will keep the SHN for now. But we will shorten the SHN to 7 days, and we will allow the SHN to be served at the place of residence. And these places are Australia, excluding Victoria, Macau, mainland China, Taiwan, Vietnam, and Malaysia. For incoming travelers from all other places, the usual 14-day stay-home notice at dedicated facilities will apply. And regardless of the duration of SHN, whether you are on a 7-day or 14-day regime, we will continue to administer a COVID-19 test towards the end of the stay-home notice. So this applies to all incoming travelers. In other words, we will have a framework in place for 3 categories, or for namely 1, 2 countries where travelers coming in will not be subject to a SHN and will have to undergo a test at the airport. Second, from a few countries which I've highlighted where they will serve a shorter 7-day SHN and do so at home. And thirdly, for travelers coming in from all other places, the usual 14-day SHN at a dedicated facility will apply. Of course, the countries in the different categories will continue to be updated over time. So this is not cast in stone. We continue to assess the situation, and we will update the list of countries over time. For outbound travelers, we will also update our advisory. The current situation up to now has been to defer all travel abroad. In line with the updates to our border control measures, we will now allow general travel to Brunei and New Zealand. We will also allow travel for students who are studying overseas, and that's because many foreign education institutions are resuming their terms, quite soon, and we know that there are students based in Singapore who are full-time students and who have to go back to school in these various institutions. By updating the travel advisory, it would mean that these students, when they travel, or travelers who are going to Brunei and New Zealand, in compliance with the updated travel advisory, will be eligible for government subsidies and insurance coverage for treatment when they return if they end up being infected with COVID-19, because they are traveling in compliance with the updated travel advisory. But such travelers will still be subject to prevailing border measures, including the payment of their stay at dedicated SHN facilities and any tests that have to be administered if and when applicable. So all of these changes to our travel measures for both incoming as well as outgoing will take effect on 1st September. I've given a broad overview of the changes. We have done this based on, as I said, our continued updates of our risk assessments in various countries, and so this is the latest position. There are a number of details that have to be worked out. The Ministry of Transport will provide more of these details in the coming days. In fact, the Minister for Transport himself will be having a doorstop later this evening to also provide some perspective. So these are changes that we are making today, but because the situation continues to evolve very quickly, I'm quite sure you will continue to hear updates over time, whether it's updates to the list of countries or updates to the measures. Next, let me touch on some updates that we have on the community front. Minister Gan has already shared the new odd-even date restrictions that we are putting in place for 2 popular malls. Beyond that, I would like to share some updates on 2 other areas. First, with regard to outdoor exercise classes at public spaces. Currently, we allow organized exercise classes to be conducted in selected venues. These are exercise classes with a total class size of up to 50 people, and the individuals have to practice safe distancing between individuals and between groups of 5. So that is already permitted, but only at selected venues. Going forward, we will expand the list of venues where such classes can be held, including at open spaces at Sport SG centers and at HDB common areas. And this means that you have PA instructors who are organizing Tai Chi classes, Qigong classes for their residents. These will be able to resume. The requirement is that all instructors who are conducting such classes will have to be registered, and there will be a registration process put in place, and they will have to be quite careful in making sure they know who are the participants in their classes and do all the necessary checks, including temperature screening, ensuring compliance with safe management measures. All of these detailed requirements will be highlighted in the coming days, and the agency in charge, which is Sport SG, will put out what the rules, the requirements are, and the changes will take effect from 1st of September onwards. Next, on F&B outlets. We have permitted dining at F&B outlets, but subject to groups of 5 people within a table and tables separated apart. But we have observed over the past weeks that there have been some F&B outlets playing very loud music. We have not allowed live music or live broadcasts, both TV and radio. And that's because of the concern that when there is live music playing very loudly, when there is live video, live broadcasts, the diners may tend to speak louder, and when they do so, there is a higher risk of droplets spreading. But we have not said anything about recorded music, and we have observed some F&B outlets where the recorded music, the piped music, is being played quite loudly. And this is a concern because of the risk of people speaking loudly and droplets spreading, especially when diners are in a restaurant in close proximity within a table without their mask on. And so as an added precaution, we will tighten the rules to make very clear to all F&B outlets that recorded music at these F&B outlets will only be allowed as soft background music. That's all they can do, right? They shouldn't go beyond that. We are also looking at the situation of where people are booking multiple tables. Anecdotally, you hear feedback of this happening in F&B outlets. And we urge everyone to refrain from booking multiple tables for large gatherings in a restaurant. We also seek the cooperation of F&B operators not to accept such reservations. Households with more than 5 people and who wish to dine out together, right? You have more than 5 people within a household and they wish to dine out together, may book more than one table so that they can accommodate everyone within the household and they can dine out together. But other than that, there should not be organized events, celebrations, or parties in an F&B setting involving multiple tables. It could be multiple tables in a restaurant, it could be multiple tables in a private room where people are gathered together. There should not be such gatherings because people in such gatherings tend to be mingling amongst themselves without their mask on, and there are risks of large clusters forming in such settings. So our enforcement officers will be stepping up their checks in F&B outlets, and they will take enforcement action against individuals or F&B operators should there be any breaches of the safe distancing rules. So these are some updates that we have on the travel side, as well as our own rules for the community. Once again, we want to encourage everyone to do their part, to stay vigilant, and to cooperate with all the rules that are in place so that we can continue to control the infection well, even as we progressively resume more activities in Singapore. Thank you.
Thank you. We'll now open the floor for questions from journalists.
Thank you, Ministers and DMS. We will now begin with the Q&A segment. Dear members of the media, please remember to use the raise hand function, and a reminder to keep to one question only. If you are called upon, you'll be prompted to unmute yourself. We will take the first question from Straits Times. Timothy?
Hi, thank you, Ministers, DMS. Now, Singapore's stance has always been to adapt different measures for travellers from different countries based on the risk level. So given that travellers from India and the Philippines have made up more than 80% of imported cases recently, why are we not taking stricter measures for people from these countries? And why are we relaxing our general rules at a time when the world is seeing a resurgence of cases? Thank you.
There is no change in the position for India. You mentioned the number of cases that we have picked up, the imported cases from returnees from India. But there is no change in the rules for India, right? Anyone who is coming back from India continues to have to serve a 14-day stay-home notice requirement in a dedicated facility. So the changes that I have said are based on evidence, are based on our risk assessments of the different countries, and as you have highlighted, the situation differs from country to country. For the countries which we regard to be safe, where the risk of importation is very low, we have decided and we have assessed that the SHN is not required, and so we are starting with 2 countries where there will be no need for SHN, but the arrivals from these countries will have to undergo a COVID-19 test at the airport. Beyond these two countries, we have highlighted a few other countries where we think, in fact, a SHN is not required, but again, out of an abundance of caution, we keep the SHN, but shorten it to 7 days and allow it to be served at home. For all of the other countries, including India, there's no change to the travel or the border control measures.
Thank you, Minister. We will take the next question from CNA Digital. Rachel, please.
Hi. Is the understanding with Brunei and New Zealand that these are reciprocal arrangements and that Singapore residents will be able to enter these countries with similar arrangements? So to those imposed on inbound travelers to Singapore. So basically, whatever that we are requiring of them, will it be the same for Singaporeans going to New Zealand and Brunei?
What I have highlighted or announced just now with regard to the border control measures for Brunei and New Zealand are measures that we are doing in Singapore. They are not reciprocal arrangements, but separately, we are in the process of ongoing discussions with both Brunei and New Zealand on reciprocal green lane arrangements. And when we are ready with the reciprocal green lane arrangements with these two countries, we will announce the details. But for now, the changes that I've highlighted refer to our border measures with regard to travelers from these countries, from all over the world, but specific to these two countries. We are making a move based on the evidence, based on our assessment of risk.
Thank you, Minister. The next question comes from Reuters. John, please unmute yourself.
Hello, ministers, and thank you very much for the opportunity. I just wanted to ask about vaccines. Has Singapore signed any supply contracts with companies or countries for any of the potential vaccines under development? And would you plan to make any potential vaccine mandatory for Singaporeans and residents here? Thanks.
DMS?
Thank you very much, John, for the question. We continue to be in discussion with various pharmaceutical companies to update ourselves about the progress of their trials for their vaccine candidates and to explore the possibility of procuring these vaccines for use in Singapore. Unfortunately, some of these discussions involve obligations not to share some of the information concerning the vaccines, and as a result, we will not be able to provide further information at this time about the progress made in some of these discussions. At the international setting or at WHO, as you may be aware that we are participating quite actively in the COVAX facility, and we continue to encourage other like-minded countries to participate in these facilities as well, with a view towards ensuring that there's access to vaccines once they have completed the various trials and are deemed to be effective and safe. And we do promote and encourage greater access of the vaccines for various countries, rather than having to adopt a more protectionist approach. We will be looking at how vaccines will be made available to the members of public and various population groups in Singapore. At this time, we have not made any decisions about whether or not vaccinations will be made mandatory. I should point out that when vaccines are made available, it may not be that vaccines will be made available in large quantities at the beginning, simply because there would be many countries wanting to have access to these vaccines, and the companies will have to ensure access for as many countries as is possible. So therefore, it may well be that these vaccines are made available in limited quantities at the onset, and eventually over time, more doses of these vaccines would be available even in Singapore. Therefore, we may have to prioritize the use of these vaccines, particularly in the initial stages when these vaccines are made available. And we would have to consider possibly prioritizing vaccines for vulnerable patient groups who would possibly have a higher risk of adverse outcomes, morbidity, and even mortality if they get infected with COVID-19 infection. And we may also consider prioritizing for those who are in the front line, helping to take care of these COVID-19 cases as well. But we have not made any further decisions about whether to prioritize other groups of people, and we have not made any decisions about mandatory vaccinations.
Maybe I should explain that, put a reply in context that I think Singapore is actively pursuing purchase of procurement of vaccines with multiple suppliers concurrently, and we are in the process of doing so, and we are making progress. As to the details of these negotiations, as DMS pointed out, some of them are confidential and some of them are commercial in nature, so we are not able to share too much details. But suffice to say that we are making progress and we are actively participating in many of these negotiations in the multiple fronts. As to the deployment of the vaccine, we have to bear in mind that there may be different candidates of vaccines that may become available, and some of these vaccines may be suitable for certain groups of people, may be not suitable for other groups of people. So how we deploy them will depend on the candidate vaccine that is available to us, and also depends on the quantity that's made available. So as and when we come across available vaccines, we'll then decide on the deployment strategy based on the vaccine that has become available. So I think it is too premature to talk about deployment strategy without knowing which particular vaccine is available. So there are many factors to be taken into consideration, but I assure you that we are actively pursuing this front and also planning our strategy going forward as and when these vaccines become available.
Thank you, DMS and Minister. The next question comes from Channel 8 News. Kai, please.
Hi, would like to check. Previously, the Malaysian government said that they are actually studying on the possibility of running COVID-19 tests on the lorry drivers who travel between Singapore and Malaysia daily. So, is Singapore in discussion with Malaysia government?
We are in continued discussions with our counterparts on the other side, but I don't have any updates on this particular issue as of now.
Thank you, Minister. The next question comes from Cao Pao. Pei, please unmute yourself.
Good afternoon, Ministers and DMS. I have a question on the Trace Together token. As the government has just announced that new batches of tokens will be manufactured, do we have a timeline as of when will these tokens be made available nationwide? Thank you.
We are actively looking into this, and we will be able to provide more details quite soon, because we have been looking at the overall Trace Together program, whether through the use of tokens or the use of the app. The program has been effective, combined also with the implementation of safe entry in various buildings around all over Singapore. So Trace Together program combined with safe entry has been an effective part of our overall toolkit, and we are looking actively at how we can do better, do more with it. So we'll be coming back with more details quite soon on the rollout of the tokens, but really it goes beyond the tokens, because it's really about getting more people to sign up to the Trace Together program, be it through the tokens or through the app, as well as through the use of safe entry. So this is work in progress, and we will be providing an update before too long.
Thank you, Minister. We'll take the next question from NHK. Kylie, your question, please.
Hi, Ministers. Thank you for the opportunity. I just wanted to get some clarification. With the border measures update, does that mean locals and residents in Singapore can travel to Brunei or New Zealand for leisure purposes? And also, are there any timeline for the government to consider easing border measures for other low-risk countries? Thank you.
The answer is yes, but it depends on the border measures in these two countries, right? So we are talking about allowing for travelers from Brunei and New Zealand to come to Singapore without SHN and subject to a test. Whether Singaporeans can travel to these two countries will then depend on the kinds of border measures that these two jurisdictions have. Of course, as was asked earlier, if we have a reciprocal arrangement, then some of these issues can be sorted out as part of a reciprocal green lane arrangement. And I've said that we are presently in discussion with these two countries on a reciprocal travel arrangement. But as of now, there is no the reciprocal arrangement is not in place. So any travel to Brunei or New Zealand will have to depend on the travel restrictions that are in place in these two countries. On the second question, as I also highlighted earlier, we have an assessment of places which we think are of lower risk, where potentially an SHN is not required. And for incoming travelers from these places, we think a test would be sufficient, right? So you come back, you are tested at the airport, and before the test results are out, we want to make sure you stay at home or you stay at a place of residence without going out. But once the test results are out, and it can be done quite quickly nowadays, and if it's negative, you can then be free to go out. So that regime will be in place for places that are of lower risk, where the risk of importation is assessed to be low. I highlighted that, in fact, we think that we could go beyond the two countries that we have announced, namely Brunei and New Zealand, but it is really out of an abundance of caution that we've decided for these other countries to keep the SHN in place for the time being, but we shorten the SHN to 7 days and we allow the SHN to be served at the place of residence. So that means we continue to monitor the situation, we continue to monitor how the infection controls are being put in place in these different countries and places, and if we think the assessment and the evidence allows for us to make a further move, then over the coming days or weeks, we will certainly be updating the list of countries accordingly.
Thank you, Minister. The next question comes from Bloomberg. Philip, please.
Ministers and DMS, good to see you. Question on the migrant dormitories. They have been cleared. And I've been hearing some kind of complaints regarding some of the workers who haven't been paid or are in a situation where they are unable to return to work, not because they are not approved by the government, but rather because they don't have the jobs. And so I'm wondering if that's to an extent true, if it's a widespread issue, and how many of these workers are we looking at who are perhaps in this kind of limbo at the moment? Thank you.
Well, I'm not sure where the sources are regarding workers who are not paid or who are unable to work. If there are such instances, and particularly where we know of instances where workers are not paid, then we will want to approach the employer and find out what's going on, because the government has been providing considerable support to employers, and we do expect employers to do their part to continue to pay the workers. That's on the pay. With regard to work, that's a different matter altogether, right? Because where it comes to work, the feedback that we are getting, in fact, from many employers is that they are really eager to get the workers to resume work as soon as possible. And there could be several reasons why they are unable to do so. One, you could be a subcontractor, and so actually you can't just resume work on your own because you are tied to a larger ecosystem of contractors, some of whom may have other issues to sort out. And therefore, the whole project is suspended And then I can understand, because if that's the case, understandably, you have to wait for all the different moving parts to be put in place before work can resume. It could also be that work is unable to restart because the employer is unable to meet certain safe distancing requirements. So it's nothing to do with the worker. The worker has been cleared, but there are requirements that the employer themselves have not met. So there could be a whole range of such issues, and we have to understand whenever such instances arise, what exactly is the reason why work cannot resume. But for the most part, whenever we meet employers and contractors in particular, the overwhelming feedback has been they really want work to resume. If there are indeed obstacles along the way, they are very keen to clear these issues, or whatever they are, and have their workers resume work as soon as possible. And in fact, when you look at the data and you look at the actual experience of these cleared workers, more and more of them are going back to the workplace. We said before, at the very start of this month, remember when we were projecting ahead that we had a timeline for the clearance of the dorms, we did highlight that because of all these different issues, not all of the workers may be able to resume work very soon. There will be a bit of a time lag. And we were expecting something like closer to the end of the month or maybe early September before you see the vast majority of workers are being able to resume work, because we are having to systematically work through with employer after employer all of the issues that they have to address before work can resume. So we are continuing this process, and we do expect more workers to be able to resume work quite soon.
I should add that for pay issues, whether you are a Singaporean worker or you are a migrant worker, if you are not paid by your employer, do let MOM know so that they can take up the issue with the employer appropriately. Because it is important to ensure that our workers get paid, whether you are local workers or you are migrant workers. Secondly, I should also add that other than the problems that Minister Wong mentioned, there's also general slowdown in the economy. So some employers may no longer have a work available for the workers, and therefore they can't resume work. And MOM has exercised flexibility to allow some of these employees, these migrant workers, to switch employer so that they can find job while in Singapore. And some of them, of these migrant workers may decide to go home because they prefer to be reunited with their family members, and we also facilitate the repatriation of these workers home. But these returning migrant workers will also depend on the conditions of the host country or their home country, whether they are able to allow these workers to return, or there may be rules and regulations, and they will have to meet these requirements before they are able to return home. So these are the work that is ongoing with MOM to facilitate and help these migrant workers.
Thank you, ministers. We will take the next question from Channel News Asia. Cheryl, please.
Hi, ministers and DMS. I would like to ask about the new 100 cases that were reported in the cleared dorms, and I understand that some of them had actually already resumed work. So do we have any more insights or understanding on where they got the infection from? Could it have been possibly from the work sites or maybe from the community? Thanks.
Thank you very much for the question, Cheryl. The interagency task force has been looking at all these cases very carefully. We found that the cases that they are picking up have been occurring in the quarantine facilities. These are workers that previously had been in the dormitories and now placed in these quarantine facilities as a result of exposure to other infected cases previously, before the dorm clearance had been completed. And when they were ready to complete the period of quarantine, they were then progressively tested, and these cases are starting to come out and are being reported in the press releases that we issue on a daily basis. We've been looking very carefully also to make sure that we don't see, that we are able to pick up any possible reinfections of cases that may have occurred from recovered cases before. To date, we have not picked up any such case. Each of the cases that are picked up that had evidence suggesting in fact, many of them have evidence suggesting that they may have had even older infections that had taken place before they may have been placed in the quarantine facility. And this is due to the testing that we're doing to assess further whether these were fresh or older infections. So the majority of cases that we continue to pick up over the last couple of weeks have fallen into these categories as well. We are continuing to look at also testing other workers that are outside the dorm setting, including in decant facilities, and they had been placed there quite early on while we were in the midst of managing the COVID-19 outbreak within the dormitories itself. And there's a need now for them to be brought back either into the dormitory setting, or they also have to be going back to work, and they need to start on their routine rostered testing as well. And in some of these cases, we've also picked up some individuals who've had signs of an older infection, and they may have indeed recovered already. But because the tests are picking this up, we're also reporting these cases. So the 100 over cases that you're talking about, they represent a mixed bag. They're not all necessarily in the same category. A number of these are in fact not new infections, but as we pick them up, we find signs that these are older infections. They're occurring in the quarantine facilities where these workers have yet to be formally cleared from COVID-19 infection, and some are being picked up as a result of the rostered routine testing that we have now put in place for workers who are beginning to go back to work as well.
I should explain that I think this is a very important question. It gives me an opportunity to explain the landscape and what we expect to see going forward. If you remember, a few weeks ago, while we're at the peak of our clearance of dorm, we see quite a number of cases, and I explained that this is because we are quite actively testing the workers in order to clear them from the dorm so that they can go back to work, and that we see hundreds of cases every day routinely. Then subsequent to that, when we finished clearing the dorm, the numbers came down, but still remain 100 over 200 cases, because those are from the quarantine facilities. And the quarantine workers are those who have been exposed to positive cases, and therefore they have a high risk of becoming a COVID-19 positive patient. And that, as we test them, when they complete their quarantine, we are likely to pick up a significant number of cases. And that was the last couple of weeks. And we are still in the process of clearing these quarantined workers. And over time, this number will come down. But again, you will have new infection, and you will new exposed close contact migrant workers. They will be quarantined again going forward. So the quarantine number will stay somewhat at a certain level on an ongoing basis. And every day we will be clearing them, and we will expect to see a number of them positive. At the same time, we also have to bear in mind that now that the dormitory has been cleared, most of the workers will be going back to work or have already gone back to work, and therefore the migrant workers in the workplace, the number will go up as work begin to be restored. And as number of workers in the workplace go up and interaction at the workplace go up, you also will expect to see the number of cases in workplaces to go up correspondingly. And therefore, it is very important for us to re-emphasize the safe management and safe distancing measures at workplaces, so as to reduce the risk of transmission in the workplaces. But we do expect that as you have more people going back to work, you are bound to have higher number of cases to be observed daily. So as you see the number of cases in dormitory come down, and over time you see the number of cases from the quarantine facilities come down, you will expect that more cases in the community will begin to pick up as more people go back to work. So this is the scenario going forward. So we have to be prepared that we will probably see higher number of community cases going forward, even as quarantine cases come down over time, over the next couple of weeks.
Thank you, DMS and Minister. We will take the last few questions. Next will be from MediaCorp 8 World, Ginny.
Okay, hi, Minister. Can you hear me?
Please go ahead, Ginny.
Yeah, okay. Hi, Minister. According to an announcement by Embassy of China on travelers from Singapore having to produce a negative test result before they traveling to China. So has this been discussed with MOH, and will MOH be facilitating such testing?
Yeah, I'll ask DMS to elaborate. We will be discussing with the embassy, and we will be helping the Chinese workers who are in Singapore who intend to go back to facilitate their testing so that they're able to return. And many of them actually have been already tested. Some of them are COVID-19 patients who have been discharged. They may still be tested positive, as we mentioned before. They may be shedding COVID-19 virus fragments for quite some time, but they have been tested and they were seropositive, and therefore they have already recovered. So these are the arrangements that we'll be discussing with the Chinese authorities. DMS can elaborate further.
Yes, Minister. I understand that this topic is something that has been raised quite recently between the two governments, and our ministries are in discussion on this topic. Our commitment is to facilitate the return of workers who choose to go back to their home countries. And we want to make sure that they have every opportunity to return home to see their family whom they have not seen for quite a long while. So on that basis, we will be discussing the matter further with our colleagues in China, and we will do what is necessary to facilitate the return of these workers.
Thank you, Minister and DMS. The next question comes from CCTV. Xue Mei, please ask your question now.
Yeah, hi. I just to ask the similar questions, because now today we found that 13 travelers, most are for Chinese workers. Then they return back to China from Singapore in one airplane from Singapore to Tianjin, and they found they tested positive. Do you think our test standard is different, or for what reasons? And can we discuss with each other to solve this problem? Thank you.
As Minister has mentioned just now, and as in our reply, when we have workers leaving our dorms and returning home, they have many of them are in fact workers who have actually recovered from COVID-19 infection. You may be aware that in Singapore, we now have a policy where we look after these workers, but we deem them non-infectious and discharge them from our community care facilities on the basis of the time from their onset of illness. And this is an approach to which the World Health Organization has also recommended, and our studies locally in Singapore have also shown that they are no longer infectious. However, a small proportion of these workers may be persistent shedders of non-viable viral fragments. And this is the reason why, on occasion, some of these workers may, in fact, still have a positive PCR test, but all other tests done for them show that they are no longer infectious. So these people who are recovered are actually fit for travel, and we have no problems in certifying them fit for travel and allowing them to board planes. We don't think there's any risk to other passengers within the plane. We have some discussions with the Chinese authorities on how these workers should be treated. And at this point in time, my understanding is that the Chinese authorities are still embarking on mandatory PCR testing for all travelers coming off the planes from any other part of the world into China. And as a result, some of these workers have been flagged as still having positive PCR tests. Each of these cases are informed back to us by our colleagues in China, and we have checked and gone through each of the cases and provided our feedback back to the Chinese authorities in terms of our assessment of these cases. However, once these Chinese travelers are back in China, it is the prerogative of our colleagues in China to decide how to look after them and how to manage them. At this point in time, I understand that a number of these individuals might still be put under quarantine and isolation on an abundance of caution.
Thank you, DMS. We will take the final question from today online. Daryl.
Good evening, Ministers. Now that border entry is allowed for travellers from Brunei and New Zealand, Ministers, do you expect airlines to resume flying for leisure travellers to these countries immediately from September 1st?
Well, I mentioned earlier that MOT is giving a statement. In fact, Minister Ong is going to be giving a doorstop quite soon. You might still be able to catch him in 5 minutes because his doorstop is at 7 and he's probably in the best position to answer this. But I would, I think, basically explain that even when the border measures are updated from 1st of September, as I highlighted earlier, any travel from Singapore, Singaporeans who wish to travel to these two countries for leisure, but number one, depend on the travel restrictions that are in place in these two countries. At that time, I don't know what will be in place in these two countries as of 1st September. Anything can change, right? They may open up more, they may tighten up further because it varies, right? And then number two, it also depends on demand because I'm sure while there are Singaporeans who are quite keen to travel, people would also be careful and would also want to ensure that there is safety before they travel abroad. So it really depends on the demand, and depending on the demand, I'm sure the airlines will adjust accordingly and would then cater to that demand. The flights would be mounted depending on the situation. So these are still early days. I think we are making a very cautious first step towards reopening, and doing so on the basis of the evidence and the basis of our risk assessment in these different countries. If the situation continues to improve in various places, then certainly we do expect more places to be the measures to be updated such that more places such that we will allow more travel to places without border restrictions as we are doing for Brunei and New Zealand, or even more places to have a shorter duration of stay-home notice requirements. Conversely, the situation may worsen and then we may well have to tighten up some more. So, as I have highlighted, this is a fluid situation. It is going to be changing quite quickly, and it is going to be unpredictable for some time. And we will continue to monitor the situation very carefully, look at the risk, look at the evidence, and then keep updating our measures. I think we are likely to be in this situation for quite some time. So for those who are planning to travel, I would say they have to account for this uncertainty, right? Because you may be looking at travel plans, say in December, but you have to bear in mind, there is a lot of uncertainty out there. So I really do not expect travel volumes to resume in a very significant way at this stage, precisely because of this huge uncertainty in the outlook in the coming months. But we will take these initial steps, and we hope that these steps will go some way in facilitating travel. And if that happens, I think our airlines will be able to mount more flights to accommodate the increase in demand.
So I should perhaps remind Singaporeans who want to travel to these two countries, don't just hop on the plane and go. Please check what are the requirements of the destination countries. Make sure that you comply with the requirements before you fly over. At the same time, when you are there, continue to exercise vigilance, continue to exercise safe distancing, and also observe the safe distancing rules in those countries so that you protect yourself and protect others. Thank you.
Thank you, ministers, DMS, for your time. Members of the media, thank you for joining us today. We have come to the end of the press conference. The time is now 7 p.m. The embargo is now lifted. Press materials will be disseminated to you shortly, including video footage, photographs, and a sound feed. Thank you, and have a nice day ahead.